Dr. Howard Fleischhahn, ACR Vice Chair of the Board of Chancellors, will now present a report on the Task Force on Corporatization. Dr. Fleischhahn.
Thank you very much, Tim. So I'm very honored to give this interim presentation to the Council on the work of the ACR Task Force on Corporatization. For disclosures, I have no financial disclosures. As you know, I am serving as the Vice Chair of your Board of Chancellors and also chairing this task force, and what's not listed on this slide is, of course, the chair of RADPAC. So timeline, this task force was recognized and formed under the leadership of Jim Brink after a robust discussion that we had at the Board of Chancellors meeting in January of 2018. Jim recognized that we needed to bring information to the membership about corporatization, bring some objective information, and also focus on some preliminary thoughts of the impact for four particular groups: radiology as a profession, radiologists, our patients, and the ACR. The task force was constituted quickly in February of 2018. We engaged a consulting firm to take a look at the environment and give us information about environmental surveillance. Frost & Sullivan was engaged. We've had multiple meetings with a variety of constituents and stakeholders, and we've submitted our final work product, our white paper, to ACR for their consideration. The task force was constituted with the intent to have a variety of perspectives. We've had a healthcare economist, radiology entrepreneur, RBMA representation, YPS. We also had an RFS representative, unfortunately, who had to step off because of personal reasons. We also had a corporatization summit with delegates from some of the largest consolidators in the industry for an exchange of ideas and some frank conversations about the state of the industry. It's extremely important when we talk about the topic of corporatization that we are very precise and specific about our definitions. And just for brevity, I'll just talk about corporatization on this slide. So the intent of the task force and the focus of the white paper is on corporatization, defined as the acquisition of assets of a medical professional corporation by private equity, venture capital, privately held, or public companies. Everybody in this audience recognizes the impact of healthcare consolidation. We have very big, very large, influential companies looking for vertical and horizontal integration in this industry, all looking to position themselves appropriately for the next paradigm of healthcare delivery. Workforce, what do we look like? These are statistics that were delivered from our ACR Human Resources Commission in 2018. Solo practice right now is fairly minimal. What is significant about this survey, this is the first time that private practice was actually below 50%. Still a plurality at 46%, but less than 50. Multi-specialty practices such as Mayo Clinic, Geisinger, and Leahy, about 10%. Those employed by healthcare systems and hospitals, about 12%. Academia is holding still at about 25%. Those in government, like in VA and military, less than 1%. Those self-described as corporate, this data is about 8 months old, 9 months old for a variety of reasons. We think this is understated, not quite 6%, but probably on the order more like 10%. Now, there is a dearth of peer-reviewed literature in this space, but there's plenty of other literature that can be found. Here's an example from Forbes magazine, and I illustrate this because it does present some of the drivers that we're seeing in this trend. There has been massive consolidation. That's the descriptors out there, massive consolidation amongst radiology groups. The description here of the 7 top 20 radiology practices in the country completing transactions, that's old news. That number is larger now. Fragmentation. A constant theme that we hear throughout this whole space is fragmentation in our industry. That presents opportunity. Other issues, other drivers, changing reimbursement models, hospital consolidation, increased demand for services, and also advancing technology, the IT demands of our industry, and things such as AI that we just talked about. Now, those of us who have been in practice for a while recognize that the idea of consolidation, corporatization, is not brand new, but certainly in this dynamic, there are clear differentiators that we need to underscore. The valuation of groups is at an all-time high. Also, the number of investors in this space has increased significantly. The amount of capital in these transactions and also the number of these transactions have accelerated significantly. The velocity of the marketplace has increased tremendously, and that's what we are all feeling and seeing now. Also, the holding periods. The holding periods for private equity groups has increased significantly. Their level of commitment and their patience to let this marketplace mature has increased. This is no longer a local phenomenon. It's not even a regional phenomenon. This is a national, if not international, phenomenon. This is a map that was created by Frost & Sullivan about a year ago. No doubt, if we were to create that map today, there would be a lot more dots in this space. Also, we are not the only subspecialty realizing consolidation and corporatization. Those that came before us include pathology, ER, and anesthesiology. We are quickly followed by dermatology, GI, and orthopedics. And finally, we are not the only subspecialty or even group in medicine taking a look at corporatization. There are many people trying to evaluate the impact of this very important trend. And I'll share with you some of the recommendations that are coming before the AMA through the Council of Medical Specialties. These are going to be brought to the House of Delegates at the annual meeting coming up next month in Chicago. And I'll read some of these recommendations. They include opposing federal legislation, preempting state laws, prohibiting the corporate practice of medicine, continuing to monitor the effect on a patient-physician relationship, financial conflicts of interest, and patient-centered care, ensuring the autonomy of physicians, informing patients of ownership arrangements, emphasizing that physicians need to retain responsibility for clinical governance, patient welfare, clinical autonomy, and due process, support transparency, and also encourage specialty societies, such as the ACR, to address the impact of corporate investor partnerships on patients and physicians. These recommendations also encourage physicians who are contemplating corporate investor partnerships to consider the following issues. What is the alignment of a practice's long-term goals with those of corporate investors? Encouraging due diligence in any transaction. Certainly obtain expert advice. Think about the control or practice decision-making and day-to-day management issues. And also the potential impact on physician and practice employee satisfaction and future physician recruitment. Now, there's lots of very strong opinions about corporatization, especially in radiology. And when you focus on the impact of the college, of the ACR, I would ask you to think about this perspective, because I think it's very apropos, and this is by Bob Still, the Executive Director of RBMA. Private equity organizations come in an industry because they think it's a good investment, but they also think there's opportunities for improvement. If these very, very smart people are saying we need to improve, we need to listen. They're an outside entity taking a look at healthcare in perhaps very different and unique and creative ways. It's not for us to say whether this is good or bad, but it just is. It's happening. In this process, we can learn. We can learn from other industries that have gone through this. It's where an organization such as the ACR needs to take the lead, and we can learn together and learn from other industries. So thank you for this opportunity to present an interim report. I'm sure we'll have more conversation.